evening, everybody. Thank you so much for giving this opportunity to share my case. And as I was saying, there is this thing my professor used to tell me and the other students in college that the eyes do not see what the mind doesn't know. He used to ask us to examine a patient, and when he doesn't get what he expected, he would say, why is it that you didn't get it? Because you didn't know. Then the eyes would see, okay, this is what is to be looked for. Now why I am saying this, I'll tell you at the end of the case. So this is my case. This is a 26-year male patient suffering from psoriasis since his 11 years of age. He did not have any family history of psoriasis. He did not have any family history. And for the past 6-7 years, he was under homeopathic treatment. So his chief complaints were he came with severe itching, and the lesions were all bleeding also when he came, and there was a lot of scaling. The other complaint he mentioned was that he has loss of appetite, that he is not gaining weight, and at that time his weight was 52 kgs. Next slide. So this is my patient. I think you can see the neck part because it's a little dull. Next slide. So that is what he came with. Next slide. So I asked him, let me tell you, this is when I was trying to apply what I learned at the very beginning of this method. So I tried asking him what is the effect of the complaints. He said that I would become conscious of the patches when I am with friends. They might think they are contagious, they might avoid me. These kind of things he was saying. When I sit with patients, when I go when I go out with friends, I'll not be able to wear a full hand t-shirt. All these things he was telling me. And then I said, he was going around with this only. Then I asked him, what do you think might happen? He said, my confidence might decrease, and whether it is with marriage or job, I feel Jeevana stuck is what he said in Kannada. That my life gets stuck physically and mentally, and suddenly he gave me a pull down will be there, hand gesture. Next slide, sir. So again I asked, because I did not know much of the case taking, I said, what's the worst that can happen? And he said, I might become introverted, frustrated, life would become like like in a room with 4 walls. I would become weak mentally and physically. I might become weak. I might not interact with people. This is what he was giving me. Then I asked, weak as in? That is what I asked, so I put it as it is. So he said, Jeevana munde hogalla. Life can't go forward. I'll remain where I am and get settled there itself, he said. Because he's not going forward and being there itself, I wanted to ask, what is going forward? He said professionally and personally, and he mentioned that job ali munde hogalla. I won't go forward in the job, I won't go forward. That's what he was saying. Then I said, being in the same place, how would that be? Because he's not able to go forward. See, again said same company, not growing, not able to come on. Then I didn't know it feels like what. So I again asked, how would it be? He said it would be frustrating, depressing. And again I asked, how would it be? He said, it would be scary, dark, there would be no light, it would be all enclosed, I would feel claustrophobic. Everybody is going forward, I can't do it, I feel limited. And he said, I feel limited. Like this, he did his hands gesture and he said, I'll be limited. Next slide, please. What is that experience in that limited? I said, please do that again, that hand gesture, and said limited. So he said, I have a fear. I want to go out of this room. Out of the room there is light, there is hope. I am trying to, but I can't. But he said, so to beat it, I go to the gym. I go to try to meet new people. Okay. So again I asked him to describe this being in the room. He said, it is blank in the head. And it is sitting and I am not able to do anything. I am trying to come out. I am opening the door but something is stopping, he said. I am trying to open the door but something is... And when I asked the experience in the body, he said it is helplessness, trying to come out and then going back. Trying to come out, then going back. Next slide. So I asked, what is the experience outside the room if you go out? He said it is light, empty, no weight, floating. I am trying to distract. He says, I am trying to distract myself so that I can feel it. But again, I'm coming back to this point 0. At that time, I did not understand. Once I tell the remedy, I'll tell you. Next slide, sir. And then I asked the dreams. The dream was also being locked in a room and somebody is peeping through a hole. Now that I come back to it, I understand. Being locked in a room, wanting to open the room. Again, the experience of the room was the same. Being enclosed, being in that 4 walls, being claustrophobic. And that is what he wanted to say. I'm trying to open the door, he says. Next. He said, so at that time I did not understand, and because for the past 6 to 7 years, he's been taking treatment where I've been working. So many homeopathic remedies, and you can take this literally, many homeopathic remedies were dumped on him. So I did not want to go for a repertorial chart and confuse him even more. So I straight away felt that this was a ringworm miasm and looked into insight into plants because I felt this was a plant. And this is what Ficus sylvatica is given as. In this, I took trying to come out of the limitation. Trying to come out of the limitation. And next slide, sir. So in this, there is this dream where the prover is in a summer house, he is bored, as if enclosed, confined with no stimulation. Now that I look back at this case, and when in the follow-ups when I asked also, he said, in that room, there is a projector, I'm watching a movie. That's the only thing which is happening and that feels like a distraction, he said. Understanding subclass 2, now I understand what is this distraction, what is this sensory stimuli, now I understand. So from time to time, this prover, who is the dreamer, he says it is alternating between telling her father, trying and not saying anything, telling and not saying anything. This is what he was giving me. Trying to go out of the room and coming back to point 0. So according to that, I felt it was a ringworm miasm. And no me versus you and no stability, instability. So I went with the plant kingdom. The idea of being in a room, claustrophobic, wanting to come out versus light, floating, no weight, I opted for Hamamelidae, and the ringworm miasm remedy was Ficus sylvatica. So I gave him the remedy. Next slide, sir. This is the follow. This was in Jan 29 that I took the case. The patient wasn't available, so he sent me the pictures on April where he said 90% of the itching reduced in the first month, and this was previous one. This was actually the bleeding site. These were the bleeding sites when he came to me, and the neck was much more. It was worse. This was in April. Next slide. This was in May, where the hands were also actually bleeding, which did not have. Next it was in June, and yeah. This is his testimony because he wanted to travel to the UK. He did not want to take the job for this fear that this might be seen and it might be a hindrance. And he said, for the last 1 year, I'm seeing good results where I'm experiencing no itches and the marks on my hands. Marks on my hands and neck, 90% disappeared. I should say my mental health also has improved considerably. That was his testimony. Next slide, sir. And I forgot to mention here because I called him just 1 week ago. He says he is now 56.5 kg, where he improved in his weight, his appetite has improved, and it's been 8 or 9 months that I've been treating him with this remedy. I was actually confused because I am still learning this method, whether it has worked or not. But the patient, not even a single month or for a period of brief period did he say that he had an aggravation or he had some complaint. Thank you so much to Shekhar sir, Swara Gurukul, and for introducing me to this. Thank you so much. And the point I wanted to add was why the eyes do not see what the mind doesn't know is, my first gratitude should be to 2 patients who volunteered to give a case here in December workshop. They actually taught ringworm miasm and the other one, malarial miasm, I believe, of Hamamelidae. Until then, I did not know what a plant looked like and what Hamamelidae is for that matter. I think Dr. Om took that case in GCT. It is known for what else case? Remember? So thank you so much. That I thank those patients because I will never ever forget it. So thank you so much for this session and thanks for the opportunity.